The president and I envision an American healthcare economy where people literally have hundreds or even thousands of health insurance products.
Everybody's got a healthcare plan, Tucker, which you probably know better than anybody else in the country. It's repeal Obamacare, replace Obamacare, amend Obamacare, and all of the plans are based on the false idea that we have an insurance problem in the United States.
Purchase health insurance across state lines, unleashing the power of the free marketplace.
When what we really have in the United States is a healthcare billing problem, a medical price problem. Insurance is only there to pay the medical bills.
Right.
Medical bills is what the real problem is. The one thing that every politician avoids talking about like the plague is medical pricing. Healthcare pricing is sick, Tucker. There's no such thing as a market price.
Is there a connection between the amount of money that's spent lobbying on health care and the dysfunction in the healthcare system?
The healthcare industry spends more on lobbying than the oil and gas industry, defense industry, and aerospace industry combined.
A lot of people are getting rich from it, especially here in Washington. I personally know a lot of people who have made a ton of money off the healthcare drama.
You're right. Everybody is getting rich on it, from the providers through the insurance companies, hospitals.
The hospital you ran got into all sorts of trouble. Most specifically, it pleaded guilty to charges that you overbilled state and federal health plans. Your former organization pleaded guilty to fraud, and therefore, how can you speak to any of this authoritatively?
You ask the price of any service, you can't get a straight answer.
I don't recall. Well, what do you mean by occupancy? I wouldn't know. I'm not sure what the definition is. What's your definition of overcapacity? I have no idea. I don't know what you mean by process. Could you define what you mean by market? I'm not sure what a market is. I don't know exactly how we market in Florida, so I really couldn't answer it.
The only answer you'll ever get is, what insurance do you have?
Right.
Everybody's price depends on how much can be extracted from you personally. And the consumer, the patient, is helpless and hopeless. We can't shop because there's no real pricing.
A stapler, $1,200. This is a chest tube that costs about $1,100. Suture, $200. This is a needle, about $800.
We depend on the healthcare provider to tell us what our individual price is supposed to be. But what nobody will tell you is that the patient that comes right after you for the exact same service may be paying 1/10 what you're paying or 10 times more than you're paying. And the price everybody else pays other than you, it's literally protected in the United States as a trade secret. You can't find out what it is. The solution is easy.
Allow people to buy whatever insurance they want. Don't tell them what to buy. Make sure you have more competition. Part of that is sell across state lines, and reward people for taking care of themselves. Those three things will drive down cost.
Have legitimate health care pricing, just like we have in grocery stores, department stores, gas stations. Nobody would accept walking into a grocery store and finding out that everybody's being charged a different random price. The store owner would probably be charged with 50 different types of discrimination.
It's obvious who's benefiting from it, because by the way, it's a handy way to shift costs, of course, and to redistribute the costs across a broad population. But it's based on lying, it looks like.
Absolutely.
The central flaw of Obamacare was that it stifled innovation, it stifled growth in the American economy, and the American people know it. And especially unleashing the power of states to innovate in Medicaid in ways that will improve people's lives.
All the wealth, basically, in the last 10 years is stuck to the top end. That's one of the reasons we've had all this political turmoil, as you know. And so kind of a hard sell to say, yeah, we're going to repeal Obamacare, but we're going to send more money to the people who've already gotten the richest over the last 10 years. I mean, that's what this does, no? I'm not a leftist. It's just that's true.
I'm not that concerned about it, because we said we were going to repeal all the Obamacare taxes. This is one of the Obamacare taxes.
Okay, so let's get to the tax policy. So it's a tax on wealthy investors, and you're eliminating it. In a health
3.8% tax, yeah.
That's exactly right. So I guess my question is, looking at the last election, was the message of that election really, we need to help investors? I mean, the Dow is over 20,000. Are they really the group that needs the help?
This was a tax on capital income, which is bad for economic growth. It's basically a capital gains tax increase, effectively, to finance Obamacare. We're undoing Obamacare, so we're not going to keep Obamacare taxes in place. And this is us keeping our word. You may want to keep that 3.8% tax. We're not going to keep it because it was part of Obamacare. Republican conservative tax policy, this is nothing but a win for conservatives.